When taking Erlotinib 150 mg tablet, make sure to take it on an empty stomach, at least 1 hour before or 2 hours after a meal, as directed by your doctor, usually once daily. The dosage will be determined by your medical condition, response to treatment, and other medications you may be taking. It's important to inform your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Avoid taking medications that lower stomach acid, such as antacids and H2 blockers like ranitidine, as they may prevent Erlotinib from working. Ask your doctor or pharmacist for guidance on using these medications safely with Erlotinib. It's also important to avoid consuming grapefruit or grapefruit juice while using this medication, as it can increase the chance of side effects. Take this medication regularly at the same time each day to get the most benefit from it. Do not change your dose or use this drug more often or for longer than prescribed, as it will not improve your condition any faster and may increase your risk of serious side effects. Additionally, since this drug can be absorbed through the skin and lungs and may harm an unborn baby, women who are pregnant or may become pregnant should avoid handling this medication or breathing in the dust from the tablets. Some common side effects of Erlotinib 150 mg tablet may include diarrhea, dry skin, muscle/joint pain, mouth sores, unusual eyelash growth, or eye dryness/redness/irritation. If you experience severe diarrhea, your doctor may prescribe medication to relieve it. It's important to remember that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, it's important to tell your doctor right away if you experience any serious side effects, such as signs of kidney problems, signs of liver disease, signs of dehydration, redness/swelling around the nails, black stools, or vomiting that looks like coffee grounds. Get medical help immediately if you experience new or worsening shortness of breath, chest pain, weakness on one side of the body, trouble speaking, confusion, or seizures. Erlotinib can cause a mild rash, but it's important to seek medical help right away if you develop any rash, as it could be a sign of a severe allergic reaction. A very serious allergic reaction to this drug is rare, but seek immediate medical help if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, contact your doctor or pharmacist. If you experience any side effects, it's important to seek medical advice. Before taking Erlotinib, it's important to talk to your doctor about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, including any liver, kidney, or stomach/intestinal disease. If you are planning to have surgery, make sure to inform your doctor about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. When taking this medication, it's important to limit your use of alcohol, as daily use of alcohol may increase your risk for stomach bleeding. Additionally, sunlight may worsen any skin reactions that may occur while taking this drug, so it's best to limit your time in the sun and avoid tanning booths and sun lamps. Make sure to use sunscreen and wear protective clothing when outdoors. If you are pregnant or may become pregnant, it's important to avoid handling this medication or breathing in the dust from the tablets, as it may harm an unborn baby. It's also important to ask your doctor about reliable forms of birth control while using this medication and for 1 month after the last dose. If you become pregnant, make sure to talk to your doctor right away about the risks and benefits of this medication. If you are breastfeeding, it's important to consult your doctor before using this drug, as it is unknown if the drug passes into breast milk and may pose a risk to the infant. It is not recommended to breastfeed while using this drug and for 2 weeks after the last dose. Drug interactions can affect how your medications work and increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include drugs that lower stomach acid, other drugs that can cause bleeding/bruising, and aspirin. If your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless your doctor instructs you otherwise. It's also important to note that cigarette smoking can decrease the effectiveness of this medication. Be sure to tell your doctor if you smoke or if you have recently stopped smoking. If someone has taken too much Erlotinib 150 mg tablet and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call 911 or your local poison control center at 1-800-222-1222. For residents of Canada, you can call a provincial poison control center for assistance. It's important not to share this medication with others. You may need to undergo lab and/or medical tests, such as kidney/liver function tests, while taking this medication. It's important to keep all medical and lab appointments. If you happen to forget to take a dose of Erlotinib 150 mg tablet, take it as soon as you remember. However, if it's close to the time for your next dose, then just skip the missed one and continue with your regular schedule. It's important not to take a double dose to make up for the missed one. It's important to store Erlotinib 150 mg tablet Antineoplastic, Protein-Tyrosine Kinase inhibitors at room temperature, away from light and moisture. Remember not to store it in the bathroom, and always keep it out of reach of children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this safely. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.